Question 41. Most common side effects of medications include A. Reduced respiratory rate, B. Increased athleteness, C. Diarrhea or constipation, D. Heart rate of over 100 bpm. Answer C. Explanation. Most medications pass through the digestive system, so common side effects are the result of being absorbed in the stomach or intestines. Nearly any oral medication can cause nausea or an upset stomach. Diarrhea or constipation are common. Other side effects can be drowsiness or skin rashes. Question 42. While giving a bed bath, the nurse aide hears the alarm from a nearby door suddenly go off. The nurse aide should A. Pause the bath, make the resident safe, and quickly go check the door. B. Stop the bed bath and go check on the location of all assigned residents. C. Continue the bath and listen for a few minutes to see if the alarm stops. D. Continue the bath but report the alarm to the charge nurse. Answer A. Explanation. An unexpected door alarm could indicate that a resident has eloped and could be a danger. If possible, call for help from a team member. However, the nurse aide should not assume that someone else will follow up with the alarm. Pausing the bath and making sure the resident is safe before checking the door is appropriate. Question 43. A resident's call lines. A. May be answered when you have time. B. May be kept out of the resident's reach during busy times. C. Should only be answered by the CNA assigned to that resident. D. Should be answered as quickly as possible. Answer D. Explanation. Call lines should be answered promptly by any available staff person. Some facilities have policies regarding how soon a call line must be answered. If a call line is not answered, the patient may try to get out of bed alone, resulting in a fall or injury. Not responding to a call line could be considered neglect. Question 44. The best time to prepare for a disaster of emergency is A. While evacuating residents, B. During a lunch in service, C. Before it happens, D. When residents are in bed. Answer C. Explanation. Training and preparation for disasters or emergencies must be done in advance. When an event happens, all staff must be able to respond automatically. Regular training is important to keep everyone current on the procedures. Question 45. When using a fire extinguisher, the hose is aimed at the A. Top of the flame, B. Area around the flame, C. Base of the fire, D. Middle of the flame. Answer C. Explanation. The Occupational Safety and Health Administration states that a fire extinguisher nozzle should be aimed at the base of the fire. Remember to use the PASS technique, pull, aim, scoot, sweep. Your facility will provide training on the fire emergency every year. Question 46. If a diabetic resident develops symptoms of increased thirst and urination, blurred vision, weakness, and a fruity smelling breath, what should the CNA do? A. Offer the resident orange juice. B. Report it immediately to the nurse. C. Wait for 15 minutes to recheck the resident. D. Report the incident at the end of the shift. Answer B. Explanation. When a resident with diabetes exhibits signs and symptoms of high blood sugar, do not give additional sugar such as orange juice or candy. Notify the nurse immediately because the resident needs insulin. If the blood sugar is not lower, ketoacidosis, a serious complication of diabetes, can result. The CNA should be aware of which residents have diabetes and what to look for regarding reactions. Question 47. A patient suddenly has shortness of breath followed by long gaps for air. After calling for help, what should you do? A. Offer the patient a drink. B. Check the patient's vital signs. C. Raise the head of the bed. D. Start oxygen at 2 liters per minute. Answer C. Explanation. When a client is having difficulty breathing, Fowler's position can provide relief. When sitting in Fowler's position, the client upright at 90 degrees, allowing the chest to expand as much as possible. Prone on the abdomen, supine on the back, and lateral on the side are all flat positions, which can make respiratory distress worse. Question 48. When making rounds at 4 a.m., the nurse aide finds one of the residents unconscious on the floor. What should the nurse aide do first? A. Call the paramedics. B. Initiate CPR. C. Takes respiration and pause. D. Notify the family. Answer C. Explanation. When a patient or resident becomes unconscious, call for help and then quickly check to see if they are breathing or have a pulse. Try to wake them. If they're unresponsive, not breathing or not breathing normally, start CPR while a co-worker calls 911. Question 49. Which sudden sign can indicate a stroke? A. Dizziness. B. Seizures. C. Slurred speech. D. Hallucinations. Answer C. Explanation. Strokes can happen quickly. The sooner they are recognized and treated, the better the outcome for the patient. Remember, FAST, FASD, to get help. F equals face drooping. Does one side of the person's face droop? Is their smile uneven? A equals arm weakness. Ask them to raise both arms. Does one arm drift downward? S equals speech. Is their speech slurred or hard to understand? Tell them to say the sky is blue. Can they do it? T equals time to call 911. If the person has any of these signs, call 911 immediately. Even if the signs go away, note the time so you can tell the doctor what time the symptoms started. Question 50. You must be especially careful about fire if the resident is receiving A. Heat treatments, B. Intravenous fluids, C. Sleeping medications, D. Oxygen. Answer D. Explanation. Oxygen feeds fire. Because fire needs oxygen to continue burning. Normal air has 21% oxygen, which can be serious in healthcare facilities. Areas where residents are on supplemental oxygens have 23.5% oxygen, which increases the intensity of the flames. If possible, turn off the oxygen supply, close windows and doors when evacuating residents. Thank you for watching.